Today is World AIDS Day, and much has changed since the 1980s when most Australians heard about the disease for the first time. Back then the prognosis was dire, and so was the public health message in ads like this.
At first, only gays and IV drug users were being killed by AIDS. But now we know every one of us could be devastated by it.
The latest United Nations report suggests the world has turned the corner and has halted the spread of HIV/AIDS, but it says the gains are still fragile. Professor Julian Gold has been involved in the diagnosis and management of the disease for 25 years. He advises the World Health Organization and has worked on HIV/AIDS projects throughout the Asia-Pacific region. I spoke to Professor Gold a short time ago. Professor Julian Gold, you've been working in this field since the very early days. Yes. Where does HIV/AIDS sit now as a health issue in Australia?
I think Australia has done remarkably well when it comes to our approach to the HIV epidemic. There's been about 20,000 people in Australia that have been infected with HIV, but largely we've been able to control the epidemic here. And I think that's because of the bipartisan political approach to the disease, the fact that we were able to engage the gay community early in fighting the epidemic, the fact that we made clean needles and syringes available widely throughout Australia has really prevented thousands, perhaps even tens of thousands of women, children and men being infected with HIV in this country.
Looking back at those advertisements in the 1980s, some might say they looked overly dramatic, but do you think that was warranted, and was that part of helping solve the problem?
I think if you look back